From my experience as a nurse working with patients with advanced prostate cancer, I find the biggest symptoms would be fatigue. Certainly, they report pain. And what I find too is an overall change in their quality of life or their activities of daily living. I see that they start to slow down and not do as much as they used to do. And although not a classic depression, I see a change in their mood also. What I always try to do is keep up an open line of communications. I try to acknowledge their symptoms, I normalize them, and I really try to create a partnership statement with them so that they feel free to discuss them with me. What I always try to do is really have them keep a diary, because it's important for me to know, for example, if they are taking pain medication, how often they're taking it, how many pills a day are they taking, because we may need to adjust, the particular dose of the drug. So I try for them to keep a diary. Also in that diary, I tried for them to include, was there a particular event that precipitated the pain? Things like that. So number of pills that they take, intensity of the pain, and precipitating symptoms or factors that may cause the pain. I think when we look at the survey, what it really shows is that a patient may say that their health is actually excellent. Up to 73% of patients said that their health was quite excellent. When the caregiver was asked, it was actually 40% of caregivers said that the patient's health was excellent. And I do see that in practice because patients do seem to minimize their overall symptoms. I think the main thing that patients and their caregivers will take away from the survey is that they're not alone, that with their experience and other men are experiencing also. So I think it's important for them to realize that other men are experiencing the same symptoms, they're not reporting them, but it's okay to report your symptoms because we can improve your activities of daily living and hopefully your overall well-being. I think from my perspective, it's really getting to know what the patient's goals and aspirations are, and really getting to know the patient. And also, as part of that, is really to try to see if their goals and aspirations are realistic, and really trying to see how advanced their disease is and how realistic their goals are. In that context, sharing with them all of the available options, talking to them about available options, possible side effects, and the impact on their quality of life is important. So it's very important to understand their goals, their aspirations, try to include all of that into a treatment plan, but also making sure that their goals and aspirations are realistic. Within the last 5 years, the treatment landscape of prostate cancer has changed dramatically. Where 5 to 10 years ago there was just a few drugs available, today there are many drugs. And hopefully we'll be able to treat prostate cancer more as a chronic disease where you can go from one drug to the next to the next. So I don't want my patients to think they have a death sentence. I want them to know they have multiple options, and the last few years has proven that. In dealing with family members, it's a little difficult because they always want to optimize the patient's well-being. And sometimes the patient may not want to eat. The intentions of the caregiver are always good. Sometimes you have to listen to the patient and allow them to do what they want to do.